I'm Dr. Duncan with BrainWell Psychiatry in Bastrop, Texas. We're here today to talk about mental health and questions that we often hear from people when they're not sure what it looks like to get help and to see a psychiatrist. I have Kyla with me today. She works in the practice and she helps with TMS and other areas. And so we're just going to visit today, and Kyla's got some questions that she has come up with that she's going to ask me. So I'm excited to announce that at BrainWell Psychiatry we're now offering CBT-I, which is cognitive behavior therapy for insomnia, to treat insomnia. And we're doing it in a group format, which makes it very affordable. And it's a once-a-week program that helps address insomnia without medication.
Yeah. Why is sleep such a big deal for mental health? Why do we need sleep? What's the biggest thing?
Yeah, so nobody likes to not sleep, right? Everybody wants to sleep. But there's some pretty important physical reasons why we need to sleep. So all our cells in our body have byproducts. So as our body is working, we make this byproduct that needs to be cleared out, and we have that in our brain. And while we're sleeping is when our brain is able to clear that byproduct out of our brain. And it allows all of our organs, our kidneys work less while we're sleeping. There's many things in our body that are restored while we're sleeping. And so it's really important that we get enough sleep so that we have that healthy.
Yeah, of course. What counts as insomnia? As far as, like, sometimes I struggle going to sleep, but I'll sleep through the whole night. What is something that you would consider to be insomnia? What if I came to you and I said, I'm not sleeping well, but it's only once or twice a week?
Yeah.
What would you consider insomnia?
Yeah. So insomnia, people have that question, do I have insomnia? What is insomnia? And so we've all experienced periods of time when we have an acute stressor, something going on that has caused us to not sleep well. A problem at work, a problem with our child, and we may have a night or two where we're not sleeping well. And so that's normal, and that's acute insomnia, right? It's just a few nights. It's when we, over long periods of time, we are having problems sleeping for months at a time that is ongoing most days, right? And then really what happens with insomnia is we start worrying about sleep. And it's the worry about sleep that actually causes the insomnia to get solidified, right? So now we worry about sleep.
Could you tell me a little bit more about the CBT-I that we are offering here at BrainWell Psychiatry and what that entails going through that course with you?
So CBT-I is the gold standard treatment for insomnia, cognitive behavior therapy for insomnia. The reason it is because it works enduring, right? It's not something that stops working like a medication can. And so CBT-I is usually done with a therapist because there has to be an assessment, and then there's when we think of cognitive behavior therapy, we think of cognition, so that's thoughts, what we think about the sleep, and then we think about behaviors, what we're doing that is trying to make the sleep better that is often making the sleep worse. And so in CBT-I, we look at those things, and then we look at something called sleep restriction, where we do a sleep prescription that helps people get over the hump of being able to sleep better. And so that can be done, like I said, one-on-one, or it can be done in a group setting, which is really helpful because then you have the experience of the group and you can hear how somebody else is doing and how they are managing certain things. And it's an effective 6-week program that we do here.
What would you say is the most challenging part of going through the CBT-I program with you?
Yeah. You know, when I talk about CBT-I and I tell people about the cognitive process, people are like, yeah, they get that. And the behavioral, you know, one of the key components is not laying in bed and not sleeping. Because when we lay in bed and we don't sleep, we start training our brain to get in bed and not sleep. Everybody that has insomnia can relate to feeling so tired and then getting in bed and immediately they're wide awake and they can't sleep. And that's actually conditioning. They've actually conditioned their brain to become stimulated when they get in bed because now they worry about sleep. And so those two people are usually pretty easy about understanding and being willing. But the third part of CBT-I that's so important is the sleep prescription part. And so I've had people say, well, I did CBT-I, and I said, well, did you get to the point where you had a sleep prescription and you had some sleep restriction done for you? And they say no, and I'm like, well, then you haven't done CBT-I because that's the most important part.
Can you tell me a little bit more about sleep restrictions? What does that look like on your side?
Yeah. So with sleep restriction, what we do is we look at how much sleep your body can produce. And so we take all the sleep that you're doing in a day. And so if you get in bed at 9 o'clock and you get out of bed at 7 o'clock and you only slept 5 hours then and you took a nap and you slept an extra 30 minutes, we take all the sleep that you're able to produce. This is what your body biologically requires. So no matter how bad your insomnia is, there's some level of sleep your body requires that you're going to get. And we figure out what that is. And then we only allow you to get in bed and be in bed during that period of time. So if your biological sleep need is 5 hours, then I'm going to tell you, okay, you want to get out of bed at 7 o'clock? Well, you're not going to get in bed till 2 o'clock or 1 o'clock in the morning. And so you're going to get in bed at 1 o'clock in the morning, and then you're going to do that behavior that you do, which is lay in bed and not think about worrying about sleep. And so maybe you'll only get 3 hours of sleep that night. Well, now we have sleep deprivation. The next night or the night after that, you're going to sleep because your body is so sleep deprived. We're going to use that to push you over that period of getting in bed and worrying because you just can't, because your body goes to sleep. Then once we have you sleeping well in that short period of time, then we start adding more sleep on. But it's important this isn't done without the other components. People are often really scared about this part of CBT-I.
Can you tell me why they're a little bit scared to do this?
It can be scary to do the sleep restriction because people think, oh my gosh, I'm only going to be getting 3 or 4 hours of sleep. I can't do that. And so we do a few things to make that. First of all, this is not on day one. This is after we have supported them and they have all the tools that they need. We have people do it around a schedule that works. Sometimes people will wait till they're going to be on vacation or doing it over the weekend where they're not going to have to deal with that. And it usually only lasts a couple of days. The other really important thing is the first 4 hours of sleep are the most restorative. And so I'll have people say, I only got 5 hours of sleep, but I felt so much more rested than I do when I lay in bed and I'm up and down, because they get that deep sleep, that deep restorative sleep. So even though people are sleeping less period of time, it's more restorative, and so they do better with it. And so it helps people to tolerate.
Oh, yeah. There's a lot of people out there with depression and anxiety that also struggle with insomnia, or vice versa. Is there a way to tell which comes first, the depression, anxiety, or the insomnia, or are they kind of interlinked together? How does that look?
Yeah. Depression and anxiety can affect sleep, and insomnia can affect depression and anxiety. We see it both ways. And so one of the things that we need to look at is a timeline, right? Did we have depression first, and are we not sleeping? In depression, a lot of times we'll see that early morning awakening where people will wake up really early in the morning, the depression gets better and the insomnia gets better. But when we have somebody that has had insomnia that's just endured, and it hasn't mattered whether they were depressed or not depressed, then we kind of see it as the insomnia is kind of on its own, not part of the depression. And then anxiety, we see people that are more anxious with anxiety disorders have a higher chance of developing insomnia. People with kind of a type A personality can have a higher chance of insomnia. When someone has anxiety, it can definitely be a a predisposing factor towards insomnia, right? And so if somebody's kind of wired to worry and their brain does that, and now we're trying to sleep, and so if we're trying to sleep and we're worrying about all our problems during the day, then that's going to be activating. And so we need the brain to be in a relaxed, not activated state, and anxiety is the exact opposite. And so really, insomnia ends up being a problem with anxiety about sleep. So somebody that has generalized anxiety, they already worry about everything, they're much more likely to start worrying about sleep. But that doesn't mean that people without generalized anxiety might not have insomnia, because sometimes people just worry about sleep, and so they just have the insomnia. So they can be together. Anxiety makes insomnia a little bit more likely, but insomnia can exist without generalized anxiety. Melatonin is good for shift work disorder, like if somebody, or if people are doing shift work and they're sleeping normally during the night and awake during the day, and that's what their brain is producing. Melatonin, is part of the regulation of sleep, and so now they have to switch over and they have to sleep during the day, and so melatonin can be helpful with that. It's helpful in short term, like when we are traveling and we have jet lag, because the melatonin is that clock in our brain that says it's time to go to sleep and it's time to go to wake. So taking small doses of melatonin can help shift that. And so that's really the more appropriate use for melatonin, is that short period. The most effective treatment for insomnia is CBT-I, cognitive behavior therapy for insomnia. That is why it's considered the gold standard. And these are some of the reasons why it is so effective. Is because medications oftentimes quit working. And so if medications worked, people would not be in my office with problems with insomnia. They'd be taking a pill and it would work. And so people get used to medications and they quit working. Or people have side effects to medications. And so, yes, they have a medication they can take. They sleep really well, but they just cannot open their eyes. They feel groggy for the first couple hours after they wake up. And so medications have side effects. And so those are a couple of reasons why CBT-I is so important, because it doesn't have side effects and it doesn't quit working. I think the other reason is because it's now a tool that you've learned, and so likely you're going to have some insomnia again in your life. Something's going to come up, and if you are more at risk for insomnia, we talked about anxiety disorder people are more at risk. Sometimes type A driven people are more at risk. You now have the tool that you need, and so you just pull out your CBT-I information, or you dust that off in your brain and you go, okay, what are those things that I need to do to get my sleep back? And so it's really a tool that people have for the rest of their lives.
Yeah. And when do you think that people should stop trying to figure things out on their own and go see a professional, like come to BrainWell and see a psychiatrist or one of our clinicians?
Yeah. So people often wonder when it's time to get help, right? If you're having problems, really any mental health issue or insomnia, is it impacting your day? Is it impacting your life? Are you having problems? Are you falling asleep when you shouldn't be? Are you irritable with your children? Is it impacting your ability to work? And so if you are having problems and it is impacting your life, that's the time to get help. That's when you should reach out.
Okay. Are there any tips that you have from your CBT-I program that you do that you might suggest to people to start doing maybe today or tomorrow, whenever they decide, oh, I think I really want to start working on my sleep?
Yeah. So, oftentimes people have insomnia, they want some help, and I actually have found that a certain number of people can get better sleep with just a few tips, just a few things that can make a difference. And so I would say the first one that I would do would be to not lay in bed without sleeping, to not lay in bed and stay awake, because it's training your brain to not sleep in bed. We want the bed to belong to sleep and your brain to go bed, sleep. And so no sleeping, no laying in bed, not sleeping. So no phone in bed, no watching TV in bed. reserving bed for sleep. And so get out of bed. If you don't fall asleep within 15 or 20 minutes, get out of bed, sit in a chair, read a magazine, do something that's kind of boring, not too exciting. Don't be on your phone because the algorithms are meant to keep you awake. And so do something until you feel sleepy again, and then get back in bed and try. Don't go to bed until you feel sleepy. If you are wide awake, this is not a good time to get in bed to go to sleep. So you need to feel sleepy in order to go to sleep. So before you get in bed, have that sleepy feeling, the heavy eyelids, and then you're much more likely to go right to sleep. I think that a big one is caffeine. You know, many people drink caffeine, and when they were younger, they could have a cup of coffee with dinner or iced tea with dinner and go to sleep. But as we age, that changes. And so really looking at caffeine, and even chocolate, if you're a big chocolate person, can be stimulating. And so not doing any of that after like 1 o'clock in the afternoon is really important. And then preparing your body for sleep. And so sometimes people want to go to sleep like a aircraft carrier, like a jet pilot on an aircraft carrier, right? It's going so fast and they want to hit the deck and hit the bed and sleep. But we really want you to approach sleep more like a pilot coming into Bergstrom.
Okay.
So we're preparing for sleep. Okay, in 15 minutes, we're going to be approaching sleep. We're going to let down the wheels. And so we're getting all these messages. So having a sleep routine that's at least 30 minutes long, where you start doing things to give your body the signal that we're getting ready to sleep, bringing down that activation, not being on your phone for 30 minutes right before you go to sleep and expect to see all the news and everything that's going on in this world and then fall right asleep. And so preparing for sleep is important. And I think that the last one is, if you do have worries, if you have things that you're worrying about, having a pen and paper next to the bed and writing down your worries, and then thinking about what time the next day you're going to think about those things. And so, okay, so tomorrow at 10 a.m., I'm going to look at these problems, because I am not a very good problem solver when I'm trying to go to sleep. And then put it down and then let go of it. So I think that those are some practical tips that can help people on the way to getting better sleep.
Yeah. How do you approach sleeping problems at BrainWell differently than just here's a prescription medication for you? How do you approach insomnia and sleep issues?
So oftentimes people want a quick fix for insomnia. They just really do want to take a pill. And so a lot of it is education and letting people know that just medication alone is often not going to be the answer. And so I would say that we start with a lot of education, helping people understand what is normal sleep. I have people tell me, I don't sleep all the way through the night anymore. And it's like, well, it's really, everybody wakes up in the night, right? And so having an understanding of what sleep looks like and acceptance. And so really kind of doing that education component and helping people understand what sleep's supposed to look like. And then CBT-I, cognitive behavior therapy for insomnia. And you know, you don't have to stop medication to do CBT-I, because oftentimes people are on medication and they're still not sleeping well. And so we'll just go ahead and start the CBT-I and get them sleeping better, and then we can say, can we wean off? Or I have people who say, I sleep fine on medication, but I don't want to be on these medications. You know, there's some new evidence that show long-term use of antihistamines, which a lot of people use over the counter, like Benadryl, increases the risk factor for dementia. And so people say, I don't want to take these anymore, but if I stop, I won't sleep. Well, that's a great time to do CBT-I. 3 things that can be negatively impacted by insomnia are mental health, general mental health, anxiety and depression. Another is long-term mental health and dementia risk. And third is relationships can be impacted by insomnia.